Before an application of push patch, here's the steps you have to go through. Step one is get everything necessary for the application. Pull one of the lyophilized vials, which are the amber vials, from the bag. Step two is you're going to grab one of the sterile waters. Finally, open up the iontophoresis device or the push patch. So now laying in front of you, you're going to have the push patch, your alcohol swab, the amber lyophilized vial, and a sterile water. We do recommend that you take it and either, gently knock the powder back and forth a few times so it's not clumping. Next step is we're going to add the sterile water to the lyophilized powder. It's very important that you do not add all of the sterile water. You're going to take the level down to the marker 2. So you're adding 1.5 cc's of sterile water to the lyophilized powder. Do not put all of the sterile water in with the lyophilized because it'll be too much water. So you simply take it down to the 2. Then you're going to put the cap back on the lyophilized powder, shake it gently, and then let it sit upright. Because these are high concentrations of peptides and molecules, we like for you to wait 5 to 10 minutes until all of the peptides and molecules have dissolved into solution. So while you're waiting for that, you're going to go ahead and prepare the skin. You're going to decide where you're going to want to put the push patch on your body. You're going to take the alcohol swab, gently clean the area to make sure there's no oil, sweat, or any type of lotions on the skin. When you're using the dermaroller, what we recommend is after you clean the skin with alcohol, you only dermaroll over the area where the application pad is going to be. You don't have to dermaroller the whole area where the adhesive at, simply where you're going to put the applicator pad with the peptide. Remember, all we're doing is creating small microchannels here through the outer dead layer of skin. We're not actually puncturing the skin. We're just creating small microchannels. Once that's done, if you look at the vial and once everything's completely dissolved, you're going to take the vial and you're going to gently apply it to the applicator on the iontophoresis patch. You're then going to pull the tab to activate the battery pack. Remember, that's a very important step. So you go ahead and activate the microprocessor by pulling the battery tab. Now that you have it activated, you're going to pull all the adhesive off of the backside of the iontophoresis patch, and then you simply gently apply it to the area where you want it to be. Make sure it's firmly on that area, and you also have to make sure you wear it for the full 12 hours to get the full dose effect.